Leone Nakona Sise, today Sarah Network come again. Now the Ministry of Information and Communication and press briefing where they can call every Thursday. Now we dey go inside the conference room for go witness the press briefing.
The Ministry of Information and Communications yesterday engaged key local state actors to discuss and chart the way forward to enhance national dialogue series on the impact of the repeal of Part 5 of the 1965 Public Order Act. The objective of the meeting is to further foster advocacy and community awareness raising and sensitization campaigns. The Deputy Minister of Information, my good self, explained to the team that we met with yesterday. It could be recalled that a bill entitled the Public Order Amendment Act 2019 has been recently gazetted. It seeks to amend the Public Order Act 1965, Act number 46 of 1965, by repealing Part 5, which deals with defamatory and seditious libel, and to provide for other related matters. Sierra Leone will join other nations around the world to commemorate World AIDS Day, which will take place on the 1st of December 2019. World AIDS Day provides an important opportunity to recognize the essential roles that community have and continue to play in the AIDS response at the international, national, as well as local levels. In Sierra Leone, His Excellency Dr. Julius Maada Bio is expected to serve as guest of honor to mark this event organized by the National AIDS Secretariat and partners on the theme Communities Make the Difference to End AIDS by 2030 at the NETA Conference Hall in Freetown. His Excellency President Dr. Julius Maada Bio has returned the Finance Bill 2020 to Parliament unsigned, following a minute paper dated Friday 22nd November 2019 from the Clerk of Parliament requesting the President's gracious assent for the Financial Bill 2020 pursuant to Part 5, Section 1061 of the Constitution of Sierra Leone. President Bio returned the Finance Bill 2020 through a memorandum to the Clerk of Parliament. He has proposed to Parliament that Section 42(6) be amended so that it makes provision for a ceiling for the non-accountable interest, and expressed grave concern over the open-endedness of the non-accountable interest as provided for in the said Act, which is prone to improper use of public funds. Finally, members of the Interreligious Council last week paid a courtesy call on His Excellency President Dr. Julius Maada Bio at State House to acquaint him about the roles, responsibilities, and activities of the Interreligious Council. President Bio said that he was happy to meet with the Council, adding that he was appreciative of the work of the Council, knowing its role during and after the violent conflict in the country and in achieving the peace. He said the Council had always been a positive actor in the country. Well, that's all we have for you for this week's weekly update. Today we have in our midst a delegation, well, a team actually, from the Ministry of Health and Sanitation. As you may be aware, of course, I'm sure you've heard about, or you've seen reports in social media and, of course, in regular media outfits about the viral hemorrhagic illness, Lassa fever especially. So today we have the Ministry of Health and Sanitation here with us, a team from the Ministry of Health. Last Monday, they issued a press release reporting new and increased cases of the viral hemorrhagic illness, Lassa fever, especially in Tonkolili district. According to the press release, a total of 48 contacts have been listed for strict medical surveillance, including 29 health workers. Well, like I mentioned, we have a team here led by the medical officer, Dr. Amara Jambai from the Ministry of Health and Sanitation. So he's here and his team to give us updates on where we are and also to make very clear some of the allegations or suggestions that have been making rounds in the media. So, Dr. Jambai, please.
Thank you very much, Deputy Minister, Honorable Deputy Minister, ladies and gentlemen, good afternoon. And I'm here with an enlarged team from the Ministry of Health just to show that it is not a one-man business, when especially you are tasked with the responsibility of overcoming challenges due to an upsurge in the number of cases of a disease such as Lassa. We all know the Lassa fever disease has been with us for quite some time now. even up down from about 2006 when we sort of declared an outbreak. It has not ended. It is still with us, and as of last week when we had the increase in the number of cases around Masanga area, we sort of stepped up our surveillance. You know, we say this, it starts with surveillance and it ends with surveillance. Thus, most of my colleagues who are here, Dr. Titi Samba, Dr. Ali Wuri, Dr. Vandi, and Harold Thomas, and Dr. Kanu, are surveillance-related health workers. They all work within the EOC, that is the Operation Center, where usually we coordinate the affairs of such events, outbreak response. We had an Ebola in 2014, and let me just say this, 2014, when we had the Ebola, we did not have the human resources required for us to overcome such events. As of that time, we did not have what we call epidemiologists. Epidemiologists are disease fighters. They are the ones who usually track diseases down to the tail and contact tracing, as the Honorable Minister had said. Now, we did not have. From 2014 to now, about 5 years, a country should have one epidemiologist for every 200,000 population. As of now, we have about 25. We've grown to that number. And as of now, we have colleagues who are epidemiologists. They are in the field tracking down this disease. So we have the required HR for us to monitor events and track events down to the tail end. But notwithstanding, it has been one of those that involved all hands on deck. We have our Director of Health Security, who is Dr. Vandi. He was out of the country when the event occurred. But because we are so, work so much as a team, Dr. Ali Wuri was able to step up and come into the outbreak and take leadership. He works hand in glove with the Deputy Chief Medical Officer, who is Dr. Titi Samba, who is coordinating the response activities. I want Dr. Wuri to come and give us a short synopsis of where we are, so that our people, will know exactly that the Ministry of Health has been on top of events and we should not panic. So Ali Wuri, Dr. Ali Wuri, please come and give an update on where we are.
Thank you, Chief. Good afternoon, Honorable Deputy Minister, colleagues and members of the 4th Estate. I will just take over from where my chief stopped. As of the 26th of November, we have not received any new case so far of Lassa fever. And as of the 26th of November, we have not received any new suspected case. Meaning that we have been able so far to curtail the spread to where it has been so far. And that is just among the health workers. And why is it just among the health workers? Is because that was where they treated the probable index cases. As of the 27th of November yesterday, we had no new suspected cases reported, all suspected cases tested now negative, and no new confirmed case since the 26th of November. It is a total of 5 cases so far and 3 deaths that have occurred so far. From this total of 5 cases, we have 3 confirmed cases and 2 probable cases. Out of the 3 confirmed cases, we have only 1 death that occurred outside Sierra Leone in the Netherlands. So far, what we have done to curtail it to where we are today, we have, just as the chief said, we intensified the surveillance, wherein we had so many contact tracers. We had, as of Friday, when we received the information, we called up an emergency meeting led by the Director of Health Emergency. We called up an emergency meeting at the National EOC at Wilkinson Road, and the National EOC was activated, and established a rapid response team from national level to go and support the district health management team in Tonkolili, where the incidences occurred. And we also mobilized the Kenema Viral Hemorrhagic Fever team to form a rapid response team that also went to Tonkolili district to support the Tonkolili district health management team. And these 2 rapid response teams went and actually intensified the district health management team's response, wherein they immediately activated the district emergency operations center on Saturday, the 26th, and thereafter all the pillars necessary for the response were reactivated with lead members who jumped into action straight away. And these pillars were the surveillance pillar, the laboratory pillar, you have the case management, and you have the social mobilization and the logistics pillar. Each of these pillars drew up their work plans to see how they can go on to action immediately and see how we curtail it. So since Saturday, when they jumped into action, we have seen the report wherein they went into action, went into the affected communities, not only in Masanga, but from where those 2 probable cases came from, and that is in the Kalansogoya chiefdom, that's the Bumbuna Axis from Mayoro, and also on the Kafe Simra chiefdom, where one of the deceased was buried. And we were able to line list all the contacts, put them under observations, and I'm pleased to say, so far from those contacts from the community, we have not got any suspected cases. These are contacts that have been monitored every day. We make sure that we had our community health workers that are monitoring those people, making sure that anyone that could have developed any signs and symptoms would have been picked up. But so far, we have not got any. And in fact, from the first probable case that died on the 9th, so far, when we look at the date of today, we have not got any suspected case from those contacts. And even from the last disease that was buried on the 16th, there too, we have been monitoring those contacts in those villages that dealt, the burial team that dealt with the corpses. They are under constant monitoring, but up to this moment that we are speaking, none of these contacts have developed any signs and symptoms. And those that are infected that we are confirmed, the health workers, out of the 3, 2 of them were repatriated to the Netherlands. And we lost one, as you're all aware, we lost one, was it on Monday? We lost the lead surgeon that was repatriated earlier. The other doctor that was repatriated is very stable and responding to treatment, and we are praying that it continues. The 3rd health worker that was confirmed is still admitted in Kenema Viral Hemorrhagic Fever, but responding very well to treatment, and I'm pleased that I even followed up few minutes before coming down, that he is very stable and is responding to treatment. And in fact, even part of his family has gone, his wife has gone to Kenema to give that moral support, and they have been communicating, of course, at a distance. So with the exception of these ones, actually, we have no new cases that we'll be worried about. And even the number of suspects have now dropped from 49 to 43. Someone will want to know how come. Because when they say you are a suspect, you are a contact that have started developing the signs and symptoms. But you are a suspect, and we'll collect your blood sample to go and confirm if you actually have the disease. And these suspects, when we have done their tests, we do 2 tests, and all of them have to be negative. And we found out that out of the 49 initial contacts or suspects that we had, 6 of those suspects came out with negative results. That is why you see the number has dropped down to 43. So I just want to explain it for people to understand. So rather than that, I think we are very much stable. We are still carrying on with the contact tracing and observation. We have activated the burial team in Chokolili district so that they become very active within those affected communities. And we are not only stopping in tracing the human beings that are in contact, but we also have a team that is from Kenema that has joined with the team from Ministry of Agriculture under the One Health approach, and they are presently tracing the rodents, that is the rats. They are setting traps to capture the rats because we want to see, first of all, those type of rats that are carriers, whether they actually carry the virus and the genotype. So that one too is being carried out at the moment. We have intensified our infection prevention and control measures within the Masanga Hospital so that we don't see any further infection from the health workers. We have also increased our social mobilization. The social mobilization team, both at national and district level, have intensified their activities both on radio, TV, and as well on community-based social mobilization. I think so far I'll stop on the update. I just want to conclude that the cases of Lassa fever are limited to the healthcare workers that I've mentioned. Not above them, just 3 health workers, 2, one we've lost, the other one in the Netherlands, and the one in Kenema district. And no new case in the last 72 hours. That I can say categorically, and maybe that will be your conclusive statement to the public, that we have not got any new case in the last 72 hours. Thank you.
Thank you very much, Dr. Hui, for that update. Ladies and gentlemen of the 4th Estate, I want to appeal to you that information that you get, especially people that we bring for this press conference, to be reported as is. Now, we know you've been doing that quite a bit, but I'm particularly encouraging you to continue, especially what we've heard from the officials of the Ministry of Health, because you know the challenge that we are faced nowadays. People, as long as they have access to mobile phones, they just go on social media and just make, baseless accusations. And in the last couple of days, we've seen and heard people saying things that they have little or no knowledge about. So again, as members of the 4th Estate, you have a responsibility to help spread the right message, the correct message for the benefit of our people. Because we know, yes, of course, we had a very deadly Ebola virus, and of course, anytime anything like that comes up, the public is bound to be afraid. But we want to assure the public that we are very committed, as a government, to make sure that what happened, during the Ebola situation does not repeat itself in this country. Which is why we have the Ministry of Health. We called upon them just a few days ago to come to this press conference and let the public know where we are with the situation. As the doctor had just mentioned, please help us pass this message, that there has not been any new case, in the last 72 hours. And of course, all of what he has said, let us please be partners in development, as we've always been, to share this information for the benefit of the general public, so that people will not take advantage of the unsuspecting public to share information that they know little or nothing about. And to those people also who are in the habit of just going about saying things, to scare people, you have a responsibility as Sierra Leoneans to make sure you get the right information. I'm sure the officials from the Ministry of Health, are there. You can always knock on their doors to make sure you get what you need in case you want to be a journalist, a citizen journalist at that. So with those words, ladies and gentlemen, we have also in our midst this afternoon a gentleman from the Technical Integration Training Youth for Social Action. Now, the government of Sierra Leone is very, very keen on improving or working towards improving the youth challenge that this country is faced with. So we are working, or we are collaborating with youth partners that are engaged in youth development, so that some of these challenges can be addressed. So in our midst this afternoon, we have Fode Morrison, and he's a CEO, like I mentioned, for the Technical Integration Training Youth for Social Action Program. And he is here to tell us about what they do as a team. And of course, later on, the journalists will ask follow-up questions. So if you're ready, Fode Morrison, can you please take the podium?
Good afternoon. Members of the First Estate, Honorable Minister. Good afternoon once again. I'm the CEO, as you are. My name is Morrison Kamarafude. We are engaged in community development. We are also collaborating with legal aid, giving them information in terms of rape, nepotism, tribalism, and access to justice. And currently we are in collaboration with the Ministry of Information and Communication after a request made by our admin to the Pan-African Parliament in South Africa. We are expecting the Majesty, the Queen of Sheba from South Africa, and also a delegate from the Pan-African Parliament. They are expected to be here today, but due to delay in terms of flights that have been scheduled, and she's going to arrive here on Sunday morning, and we'll also be having the Pan-African Parliament and Talent Award Conference on the 2nd, that is Monday. And also we are having the Joe Praise and Harmony and other African artists. They are going to arrive here on the 3rd, and we are also expecting the First Lady from Nigeria, and the visit of the Royal Kingdom from South Africa. They are here in order to collaborate with government to see how best they can help youth in terms of agriculture and also supporting the free quality education. In addition, we are calling on you because you have the power, at least, to reach our people. And also in this award, we are expecting also the legal aid to undertake a debate on legal education, women's and children's rights issue are also going to be discussed in the debate. The debate will commence on the 3rd. I will give you the program of events at the end of this press conference. Thank you all.
Una sef don listen. The updates wey comot today inside the Ministry of Information and Communication and press briefing. And also today inside the press briefing, we be get to see the Chief Medical Officer and him team wey can talk, but the 72 hours wey they don dey observe, wey they no witness any case 8. They no get any record at all concerning the Lassa fever rumours wey don dey go around na Sierra Leone now. For say people dey no dey get affected with Lassa fever, but e don make clarification say inside the last 72 hours they no record any new case. We will bring this program come to you today. My name na Kuna Sise. So till we meet again to another edition of Press Briefing, I say tata.